What's going on, everyone? Happy Friday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, April 19th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update for all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of viruses out there, and you need to be safe. You need to stay informed. The best way to stay informed and staying safe is subscribing down below, because we talk about these viruses every day to help keep you in the know and you and your loved ones safe. Want to help other people stay safe? You can easily do that as well by hitting that share button down below. If you like the content you see here today, give this a thumbs up, especially if you learn anything. If you have anything to say about what you see on here, maybe it's something I'm getting wrong, maybe it's something I'm not showing, or maybe it's just a comment in general, anything, put it down below in the comments section. The more interactions we get, comments, likes, shares, the more YouTube will share this content out through the algorithm. Alrighty, we do have several news stories to talk about today, and I'm just looking up here. We have a lot of tabs to go through because remember, it's Friday. CDC data updates. We're going to take a look at some of our daily data. So let's get right into it, shall we? Just going to read a headline here. COVID patients' infection lasts a record 613 days and accumulated over 50 mutations. So, yes, he accumulated over 50 mutations in 613 days, and I do believe I read that this was in the Netherlands that this happened. So, wow, this is absolutely crazy. The fact that he survived to tell a story is just unbelievable. If you want to fully read about this, I did tweet it out down below. Taking a look at this, South Korea, it's a sign of the times. Who knew that there was still any country left that still called COVID a pandemic? Let's face it, you and I both know COVID is still a pandemic. Deaths are far too high. Long COVID is a massive issue. Until we can get that down, until we can find a way to get infections down, quite frankly, it is still a pandemic. South Korea is going to be shifting to the term endemic in the next month, starting next month, which pretty much the majority of the world calls it now. I don't know of anywhere else that still calls it a pandemic. Maybe there is still somewhere that calls it a pandemic. All right, I posted this yesterday onto Twitter. UK has started to see a rise again. It used to be in the last few years, or in the first few years of this pandemic, we would follow them in just a few weeks. Just something to keep an eye on. Right now, I'm not terribly concerned with what we're seeing, and I'll show you more of the data in a moment. We're not rising right now in the United States, but the UK is seeing a slight rise, so it's something we're going to have to keep an eye on because we did used to follow them, and maybe we're going to go back to following them. I don't know, but right now, the United States is not rising, and I'll show you that in today's data in just a little bit. Possible measles exposure identified at a suburban Sam's Club. Want to read all about the exposure and everything? I did tweet this out as well. Now taking a look at this. This is rather interesting. Worsening allergies is tied to climate change and severe weather. As doctors report more allergy symptoms in patients, scientists are blaming climate change and severe weather. NBC News and Thompson reports. And without going any further, I can add my input on this because, remember, I do follow, as a hobby, I do follow meteorology and climate very closely. And with our changing climate, several things happen. We're having warmer winters, so the growing season is lasting longer. So if things are growing, your likelihood of having allergies is always on the rise. Plus, we are seeing more and more rain in a lot of places. Like, for example, here, so far this year, I'm already up to 20 inches of rain on my weather station. That is just absolutely insane considering it is only April 19th. With more moisture, there's more chance for mold. There's on and on it goes. There's so many different reasons that warmer climate can lead to more allergy problems, with the number one being the winters. They haven't been all that cold as of lately. We didn't have much of a winter here at all. And now moving on to this salmonella outbreak linked to contaminated basil sold in Tennessee and other states. The CDC is warning that contaminated organic basil sold at Trader Joe's locations in Tennessee and 28 other states has been connected to a string of salmonella infections. So there you go. If you want to read more about this, I did tweet this out as well. All right, moving on. We don't have anything to show you on the website, but I do want to show you today's air qualities. We have to refresh this. It's going to come up. And no, we don't need to see this one particular site. Let's see, let's exit that. There we go. Just a few bad areas. From the Appalachian Mountains, just literally in between I-81 corridor and I-95 corridor, and then down the I-85 corridor on the east. Yes, there are some problems. Atlanta's seeing some problems. And Gulf Coast slightly moderate. And Texas, southern Texas. Look at this in Mexico as well. Wow, that's not good. Great Lakes, you're not doing bad. Northern Plains, pretty good. California, Los Angeles today is worse than we have seen for much of this week, so that is not good to see. Taking a look at today's severe weather threats, not much to talk about today. So there's just a marginal risk of severe weather in the southeast. For the rest of the country, you're safe for today, and there will also be a marginal risk of severe weather tomorrow in the south and down in Texas, so be mindful in those areas. Tornado risk is relatively really low. It's wind and hail threat for you, so stay safe, be weather aware in those areas. All right, pollen levels. We just talked about pollen and climate change a little bit ago. Well, take a look at this. Pollen levels up and down the East Coast, they're moderate to high, and in more areas than not, they are high. Same with the Midwest, back into the plains. A lot of high areas today. Taking a look into the Pacific Northwest, you have high levels as well. And we do have, down in Los Angeles, though your air qualities are bad, you are having bad air qualities. So you get a break on the pollen levels, so it's kind of a toss-up there. It's kind of like a trade-off because, well, the air quality's bad, but hey, the pollen's not good, so. But in some areas, especially like on the East Coast, it's a double whammy. You get the bad air quality, and you get the pollen, and surprisingly, I'm holding up pretty well today with the air quality and pollen. Maybe it's my injections that I get for my breathing. I really think they work. All right, taking a look at EMS calls for Philadelphia yesterday. 669 EMS calls have been reported for Thursday, April 18th. Doing a live look in at what's going on in Montgomery County, Pennsylvania. 13 calls right now, and we do see respiratory emergency listed a few times, and we do see a scattering of other things. We also have a landing zone that's going to be happening in Skippack, Pennsylvania. I don't know what that's all about, but something's rather serious. They need to airlift someone. And Chester County, Pennsylvania, I see not one, not two, but 3 respiratory calls and a scattering of other types of calls as well. Walgreens did upgrade this week, and you can see here, 13% positivity rate for COVID. Prior week was 13.5%. Difference of down 0.5%. Total test 4,875. The prior week was 5,867. We may take a look at a few more states again tomorrow. BioBot, it's not terribly concerning. BioBot, for the most part, is flat in the northeast. Actually, it's dropping a little bit in the southeast, dropping a little bit in the west, and an ever so slight rise in the Midwest. That just could be noise, and that could correct to going back down again next week. Don't really want to take a look at any wastewater sites. No. We'll do a few wastewater sites tomorrow, then we'll do our big wastewater bonanza on Sunday. However, though I'm not going to show you wastewater scan, I do want to show you this on the CDC wastewater page. If you're new here and you don't know what these colors represent, red represents the highest level of COVID on their map. Well, take a look at this. 80 to 100% COVID detected. It's down to just 3 sites. I'm telling you, we're getting close to 0. And I think pretty soon, I think we'll hit that 0 red mark before we start a new wave. I'm confident we can get there. Fingers crossed. Okay, let's see. Hopefully we can do it. And let's just real quickly look where they are. There's one in western New York. Wow. Niagara Falls. You know what? This is a small wastewater site. But what went on in Niagara, New York? What went on there? Total eclipse. Haha. Check that out. That could be related to the eclipse. And I'm also seeing Russell County, Virginia. Though it's stabilizing, did see a rise, and that is red. And there is another red site here somewhere. Is this it here in Missouri? I think this is it. Clay County, Missouri. Only 12,000 population. It's rapidly going up, and they're still in the red for some reason. All right, taking a look at some CDC data. We don't want to do this day in COVID. There is something for today, but we'll skip over that for today. And let's just quickly take a look at hospitalizations data and hospital capacity being used. 75.3% is being used around the United States, 0.9% for COVID, 0.5% for influenza. Taking a look at ICU usage, that's 70.3%, 0.9% for COVID, 0.6% for influenza. So not terribly concerning, but though it did go up slightly from the previous update, and it's saying the 13th, so I don't recall. Is this what we reported on last week? I'll have to go back and watch my video from last week because I would like to show more states over the weekend, to kind of fill the void because we don't get as much data on Saturdays. Taking a look here at CDC hospitalization data. This is actually really good. I'm going to be positive pretty much throughout the entire new update of the CDC data. COVID hospital admissions in the past week, 6,406. That's down by 13.8%. That's really, really good. We don't need to look at that map. Honestly, I don't know why. There's only one area that's actually high at this point. New admissions. Wow. So the whole country is actually green. Or could the CDC be going back to a nice peachy, rosy green map? I don't know, but hey, if this is correct, that's really encouraging. Wow, I think that's the most green we've seen on there in a very long time. Also wanted to show you this. The United States test positivity rate. I know, it's not really that useful, but 3.4%, it's down by 0.4%. Taking a look at this, epidemic status for COVID. It is likely declining at this time, or declining in the majority of states, although to be fair, there's quite a few states that are either stable or uncertain at this time, and we can see here, yeah, I didn't count how many there are, but yeah, there's at least well over a dozen states that are uncertain or stable at this time. But overall, it's a good picture. When we come down to influenza, a lot of states right now are really declining, and then there's a ton as well that are likely declining, and just only a few that are stable or uncertain. So we don't have any likely growing or growing states for either of these. We'll get back to influenza in just a moment. No update today from the variant proportions, and it's sounding like it's going to be just only one region that reports in the next update. I don't know. I'm hearing some things that it might just be down to one region, so I don't know how that's going to work because that wouldn't be all that accurate. JN.1 is 83.7% of the cases. JN 1.13, 9.1%. JN 1.18, 2.5%. JN 1.16, 2.4% of the cases. Influenza. For the most part, it's good, but we do have just some slight increases. You can see here, I'm animating it. It's still high in North Dakota. And then this week, we now have high in Wyoming, and we have moderate levels in New Mexico, and we're back to moderate levels in Alaska as well. Still moderate levels up in Massachusetts, and for the rest of the country, it is either low, minimal, or insufficient data, and I don't see anywhere that's not reporting, aside from DC is insufficient data at this time. All right, New Jersey today, 194 hospitalizations, 67 out of 70 hospitals reporting, 9 people on a ventilator, 25 people in the ICU, discharges, another 24, that's really good. I want to see, can we get New Jersey below 150 before the next wave comes? Can we get it below 100? Now, that would be a reach getting it below 100, but can we get it below 150? That would be a great goal to see happen. New York State, 528 cases, doesn't include at-home tests. And I should mention that CDC test positivity rate that we showed doesn't include at-home tests. So we don't know what the positivity rate is for at-home tests, so it's not always as accurate. Back to New York State, taking a look here, we can see that hospitalizations, they continue to drop. 461 people in the hospital, 53 people in the ICU. I'm setting a new goal for New York State. I would like to see New York State get below 400 hospitalizations before another wave sets in. Can it happen? You know what? I think it's possible. Look at this. I mean, they were rapidly dropping, and they are still steadily dropping. There was a little period where it tried to go up again, but it didn't happen. And it just hasn't been happening. And if anything, I think they're starting to drop even faster again. Started the week at 508, down to 461. I think by May at this point, they would be in the low 400s, maybe into the 300s. That would be a huge milestone. Let's make it happen. All right, moving on now. We have to take a look at LA County. We need to refresh this. Hopefully it does update. I'm not certain whether it updated or not. Let's see here. Now, it's as of the 13th. So as of the 13th, they had hospitalizations 136. The deaths were dropping. And the cases, yeah, they were dropping as well. Testing. The amount of positivity rate, it went up ever so slightly, but again, it's not terrible. This is as of the 14th. They are starting to see a slight increase in the positivity rate in LA, but again, not terribly concerning just yet. And I do need to refresh California. Drum roll, please. Did we get an update out of California? All right, hospital admissions in California. They're up ever so slightly. Deaths are up by 0.4%. Positivity rate rose by 0.5% to 2.4%. Hospital admissions, yeah, they're up a little bit. They're up by 20%. And influenza deaths, this is for hospital admissions for influenza now, that's up. COVID was just ever so slight increase. It was only up by 1. Taking a look at influenza deaths, they're up slightly. Influenza test positivity rates also up slightly. And it did look like some of the West Coast states, when we go back to the CDC map here, we can see here, there was a slight coloring increase in some states, but California was not one of them. California's coloring actually went lower, but their neighbors to the north, Oregon, did go a little bit higher. Alrighty, folks, that does it for today's pandemic update. We'll have updates throughout the weekend, tomorrow and again on Sunday, and who knows, maybe I'll find something else to do one of them YouTube shorts as well. Yeah, we were in CVS today and we saw that the price for a COVID at-home test kit with just 2 tests was close to $25. That is totally ridiculous. It should not be that expensive. You shouldn't have to pay your hard-earned dollars for something that was allowed to just continue to spread on. But here we are. Carry on. Alrighty, folks, I will see you all again next time. But until I see you again next time, you got to do a few things. Give this a thumbs up if you liked the video. Subscribe if you want to see more content like this. Leave a comment down below if you have anything to say. Share this video with anyone you know. And of course, most importantly, stay safe, everyone. Thanks for watching. Have a fantastic Friday evening. And if I don't see you this weekend, well, if you don't tune in this weekend, have a fantastic weekend. See you all next time. Bye-bye.